Hello, NTP632 family. My name is Sam, and I'm going to be representing group number 2 for this week's discussion. The specific elements of the study design that my group was assigned to were which psychedelic to investigate and what are the treatment factors. The psychedelic drug that my group settled on was psilocybin. This is due to a plethora of reasons, primarily being that there's plenty of research and data available in psilocybin currently. Although this research might not be focusing on the treatment of PTSD, it serves as a baseline for understanding towards the safety and possible adverse effects that could arise from psilocybin and drug-drug interactions that could be a problem. Additionally, once and if psilocybin does receive FDA approval, it's possible for psilocybin to now be prescribed for off-label purposes. So that might make investigating psilocybin for PTSD treatments a little easier and a little bit more practical. Additionally, an important aspect that we need to consider is the duration. So what you want is a psychedelic that lasts enough time that allows you to work through these traumatic experiences and talk about them and restore them, but not so long that's eating your day, maybe 2 days, and it's costing a fortune. So ideally, we want to use psilocybin for PTSD treatment studies, as psilocybin has a plethora of data available that you could kind of build upon and use as inspiration, while also it has an ideal duration. Additionally, concerning the treatment factors, my group took a fairly pragmatic approach. Regarding blinding / placebo, yes, pretty conventional with what's been done in the psychedelic space so far. Therapy or just the meds, therapy in conjunction to the psilocybin experience. Again, nothing out of the ordinary to what's been done so far. Dose range, we're thinking a single dose, 20 milligrams to 30 milligram range. And crossover, yes, we think it would be beneficial for the study design to be a crossover study, as people can be controls for themselves, but also because both subject groups will experience the potential medicine. So most of this was pretty much inspired by what we know we can do in the current landscape. But we had some pretty creative and great ideas, I would say. To start off, regarding blinding. Blinding is fairly problematic, especially when we're talking about psychedelic studies. There is no really good placebo in such a context. A really interesting idea was the use of VR virtual reality and how we could incorporate that to have more deceiving placebo experiences. Another idea would be to forego a placebo group entirely and instead have the experimental setup feature 2 groups, one taking the experimental drug psilocybin and one taking another drug that could potentially become the standard of care for PTSD treatment, which will be MDMA. We already have pretty good data comparing MDMA plus therapy to placebo plus therapy. So if we could get a comparison between psilocybin plus therapy in comparison to MDMA plus therapy, then intuitively we know the relationship between psilocybin plus therapy to placebo plus therapy. For this instance, for this hypothetical experiments, it would not be a crossover study. On the topic of dose range, we of course believe that having more data across more dosage of psilocybin is more valuable than having less data across less dosages. But if we're trying to be pragmatic and think about the costs, once more funding can be allocated, then maybe we can start examining multiple dose studies. Essentially, my group came up with a very simple 2-arm study with a niacin control group and a psilocybin psychotherapy group on one arm and a niacin control group. Overall, my group came up with a pretty simple suggestion for the experimental design. We're going to examine 2 groups, one given a niacin placebo, one given mid to high dose psilocybin group. Both groups experience psychotherapy. Both groups experience both treatment protocols, meaning that it is a crossover study, and it's only one dose range. But if circumstances were better and certain other drugs that are close to being approved were already approved and funding for research was not a limitation, then we would actually take this a much different direction, and we would potentially consider incorporating virtual reality, other psychoactive substances to act as a comparison group, and also maybe not even having a crossover study for such an instance. Overall, this was our thoughts, and I hope you found something interesting, and I'm looking forward to hearing your thoughts on our thoughts. Peace.